Good morning, everyone. Welcome to another Facebook Live chat sponsored by The Record, NorthJersey.com, and the USA Today Network, New Jersey. I'm Mike Kelly. I'm joined this morning by my colleague, Lindy Washburn, The Record's chief medical writer, and Dr. Adam Jarrett, the chief medical officer at Holy Name Medical Center in Teaneck, which is at really the center of the COVID-19 pandemic here in North Jersey. This morning, we'd like to invite you to ask whatever questions you might ask of Dr. Jarrett, and just simply write them on our Facebook link, and we'll try to relay them. Good morning, Dr. Jarrett. Let me begin by thanking you for making time this morning. Really appreciate it. I know you're very busy at the hospital. I think people are understandably concerned and anxious about how this COVID-19 pandemic is affecting them. They're fearful. If someone thinks that they might have the virus, what should they do?
So I think the most important thing to keep in mind is that although certainly there is fear out there about this virus, the vast majority of people who get this virus are going to do just fine. That is really very clear at this point. And so people who are at home who think they may have the virus, if they have symptoms of fever or cough, we're also beginning to see an awful lot of people who just have diarrhea. If they think they have concerning symptoms, instead of what they would normally do, which would be to make an appointment with their physician, it's extremely important that they reach out by telephone and converse with their physician. At Holy Name, we set up a telemedicine line that allows the physicians to call here and contact us. If you speak to your physician initially, the physician can reach out to us at Holy Name, and if appropriate, we can set you up for testing. If you have more significant symptoms of very high fever, or symptoms of shortness of breath, which to be very frank is the most concerning symptoms, then you should come to the Holy Name emergency room or your closest emergency room. But if you do that, it's also extremely important that you call ahead so we can be prepared to treat you as a possible coronavirus patient. And that's important so the staff who are taking care of you can be in appropriate protective gear, and we can make sure that we keep the medical community as safe as possible.
So what are the circumstances, Dr. Jarrett, under which a person who's sick at home decides that they need to go to a hospital? What should they be considering as the threshold? Now I need to go.
Yeah, the most important symptom is significant shortness of breath.
Mm-hmm.
If you're a little bit short of breath, but when you're sitting at rest at home, you catch your breath easily, then it's important that you're in touch with your physician and that we potentially set you up for home monitoring. We have the ability to do that with a small machine that actually monitors your oxygen level at home, and we can monitor that continuously. So if you have even a little bit of shortness of breath, you really should be hooked up for one of those home monitors, and we can arrange that through Holy Name, and I think the other hospitals in the community can also do that. If you have anything more than mild shortness of breath, or if your numbers that we're monitoring on that telemedicine device show that your breathing is becoming more labored, then it's important to come to the emergency room. Because the thing that we're seeing that is most affecting people when they get significantly ill is the coronavirus affecting their lungs and creating significant breathing problems.
Doctor, kind of a practical question. Suppose you don't have a primary care physician. Suppose you don't have health insurance. What should you do?
So if you reach out to Holy Name directly, we can also arrange for you to have that telemedicine connection with us. So that is not an issue at all. We will obviously take care of anyone who needs to be taken care of.
One of the issues that I think is really a lot of people are talking about right now is if they venture outside for whatever reason, they're healthy but they want to go outside. There's been a lot of talk, particularly in the last day or two, that people should be wearing some sort of mask whenever they go out. What are your thoughts on that?
So this is a very controversial topic, and up until recently, all the public health experts were saying that people really should not wear masks. I would not be terribly surprised if we see a change in that recommendation over the next day or two. My general feeling is that you really need to socially distance yourself, and therefore you should not be outside except for absolute necessities. And when you are outside, you still need to socially distance yourself. And if you do that, wearing the mask is really an unnecessary step because you're socially distancing from yourself from other people. If you are having any symptoms of concern and you go outside, then you absolutely should be wearing a mask. I think that the CDC and the World Health Organization may make a change in their recommendation and may make recommendations for people to be wearing masks outside. At this point, they're not making that recommendation, and I am not recommending it for several reasons. One, we need to keep the masks available for the healthcare workers. As many of your listeners are hearing, there's a real shortage with masks, and we need to keep our healthcare workers well for their sake and also for the people that they take care of. The other issue is putting a mask on and off and putting gloves on and off. There's actually a technique to doing it, and if you do it wrong, or if because you wear a mask you think you're safer than you really are, and you don't follow the social distancing recommendations, the mask can actually be more harmful than helpful.
And just to remind our listeners and viewers, the social distancing recommendations are what, 6 feet or 10 feet? Well,
the current recommendations are 6 feet, which is sometimes very difficult. But it's 6 feet away, and if you're going to be closer to someone for closer within 6 feet, to try to do it as brief a period of time. I know that in elevators and people who live in buildings, really you should go up on the elevator on your own. Whenever possible, even in your close-knit family, you should try to socially distance yourself, even in your own home, as much as possible. Because the reality is that people still have to go out to the supermarket. And so there is some potential exposure when you go to the supermarket. So even in your own home, if you can socially distance as much as possible, you should do it. Certainly here at the hospital, we are doing as many meetings as we can via telemedicine. People are walking farther away from each other. In our cafeteria, we have spread out the tables. We're doing everything we can. We're not going to stop every single infection. We're just past that point where we can stop every single infection. But every time we stop a single infection, we prevent that cascade of infections that occur. And unfortunately, because in a small but real percentage of people who get this disease, they get critically ill. Really, every time we stop an infection, we stop that cascade, and we probably or definitely save lives. So when you are socially distancing yourself, you're not doing it just for yourself, but you're doing it for your community as well.
Just to follow up one more time, let's take this inside the house, as you suggested. Should husbands and wives or partners be sleeping together?
No, that's a really good question. I have to tell you that my wife and I are still sleeping together in the same bed, but we try to use a separate bathroom. We have not been affectionate with each other as we normally would be because of the possible exposure. So I do think that people need to be as practical as possible and socially distance as much as they can, including in their own home.
What about things like shopping at the store? And how should you treat the groceries when you bring them home?
So the good news is there's not a lot of evidence that this virus lives on paper or other products like that. But we do need to be sensitive to that. So we should be washing our hands as much as possible. And you should be washing your produce as much as possible, because we're still learning about this virus. As much as possible, especially if you're in the elderly population or have significant comorbid conditions, you should go to the supermarket at off hours if possible. I know most of the supermarkets are restricting the number of people that are coming in. And when I drive by the supermarkets, I see people queuing outside the supermarket 6 feet apart. And that's really important. Again, we are not going to stop every single infection. Unfortunately, more people are going to get infected, and the vast majority of them are going to do fine. But everything that we do that stops even a single infection has a significant impact.
It's interesting you mentioned that, because we have a question from one of our viewers, and she says that a doctor who is a family friend is saying that eventually everyone will get this infection. It's just a matter of time. Is that correct?
I don't think we know the answer to that. We do know that unlike the regular flu where we have vaccinations, the entire population is vulnerable. I've heard estimates from experts that as much as 80% of the population are going to get this, and I think that's likely. We're also hearing more and more evidence from experts that maybe as much as 25% of people who get this are asymptomatic. That's good on one hand. It's concerning on the other, because it means that asymptomatic people who have minimal or no symptoms can potentially spread this, which is why it's extremely important that every individual for the foreseeable future treat themselves as if they're positive. That's my recommendation for people. Assume you have the virus. Assume that you're potentially infectious, and socially distance yourself. Now, does that mean you have to wear a mask? I actually don't think so. I think you're safer socially distancing yourself, being 6 feet away from other people, than wearing a mask and taking that away from a healthcare worker and potentially wearing the mask wrong. If you wear the mask wrong and you put it on and off your face and you don't wash your hands appropriately, the mask itself can actually become a vector for infection. And so I think social distancing is the utmost importance. And I think it is likely that a large percentage of the population will get this. We won't know the answer to that until we have a test that allows us to test for the antibodies of whether or not people have had this disease. And I think that will likely come sometime over the next few months, and we'll be able to answer that question better.
We have another question that kind of follows that from one of our viewers. And she asks, will 30 days be enough to end this? Can we start getting back to normal in early May? The governor is saying no. Some people in the federal government are saying yes. What's your belief?
I think it's unlikely that 30 days are going to end this. I think that hopefully over the next 2 to 3 weeks, we'll be out of this immediate crisis and things will begin to slow down. Mm-hmm. I think at least 30 days, maybe 60 days are going to be necessary, and maybe even a little bit longer before we can go back to life as relatively normal. But I do think we need to be aware of the fact that even once we get through this initial cycle, until we develop a vaccine for coronavirus, it is likely that we're going to see other peaks and valleys of this disease. We're socially distancing now, 1, to protect ourselves, but 2, to allow the healthcare system to take care of the patients who become significantly positive. And so there are going to be an awful lot of people who, because they socially distance themselves, did not get the virus. And that's great. That's the idea. But as we begin to loosen up the social distancing requirements over the next 30 to 90 days, we will likely have another cycle where we see more people get ill. If we do this right, that cycle will be much less severe than the first cycle. And then unfortunately, it's likely probable that we will continue to have other cycles of this disease, hopefully each one being less intense and each one affecting less people as more people become infected and immune. And then hopefully early next year, we'll have a vaccine where we'll be able to put this to rest.
So this is not over by any means once we get through this initial period here.
It is not. The real hope, and I think the real expectation, is that the crisis that the healthcare system is going through will significantly subside over the next 30 to 90 days. But I think we'll be dealing with coronavirus much like we deal with the flu. The difference is we don't have immunity toward the coronavirus. So until we develop a vaccine and have that immunity, we're going to be talking about coronavirus and dealing with coronavirus for a long time. But I think it's really important. The vast majority of people, far and away, the vast majority of people get this, don't even know they have it, or get this and have a couple days of fever and then are fine. It's really about minimizing the number of people who get this in lumps of time, so the healthcare population can take care of the population who gets severely ill.
Lindy, I know you have a number of questions you wanted to ask. Can you jump in here?
Sure. First, I wanted to ask a question from a viewer. She's wondering about whether her child, who's 1-year-old, should go through with the well baby check and vaccinations. And I wondered if you could also address more broadly what people should do about just the normal kind of health issues that they need to take care of during this time when doctors' offices are closed and such.
Right. So most doctors' offices have developed telemedicine capabilities. So in terms of any specific question you have about your health or your well-being or whether something should be delayed, the best thing to do is to reach out to your individual physician and have a telemedicine visit. I can tell you at Holy Name, we are delaying most things that are elective. Most things that we know that if we take care of them today versus taking care of them 30 or 60 days from now, it will not have an impact on the patient. So, for example, we are delaying routine mammography. We are delaying routine colonoscopy. For the population of patients who unfortunately are dealing with cancer, we're looking at that on a case-by-case basis, but we are certainly not delaying chemotherapy or radiation therapy or surgery related to cancer. There are many things that are time sensitive. A well baby check, I'm not a pediatrician, but my guess is that is not that time sensitive. And a lot of that can be done via a telemedicine visit. And so I would suggest that people reach out to their family doctors, their pediatricians, their internists, and have those conversations about what things can be delayed safely and what things cannot be delayed safely.
All right. I'd like to also ask about the hospital situation. We hear a lot from the governor and officials about the healthcare system being overwhelmed. Can you give us a picture of really what's going on in northern New Jersey hospitals and at Holy Name in specific?
Sure. So unfortunately, we got hit first here in Teaneck. And so we've been in the middle of this for about 3 weeks, 3.5 weeks now. I can tell you that when I speak to my colleagues at the other northern New Jersey hospitals, they're unfortunately right with us now. So all the northern New Jersey hospitals, and unfortunately, I think soon all the New Jersey hospitals are going to be dealing with this. And our emergency rooms are crowded. The hospitals are filled with non-critical patients, and unfortunately an awful lot of critical care patients. So I can talk more specifically at Holy Name. So we currently have 165 patients at Holy Name that are either positive for coronavirus or we suspect are going to be positive, and we're waiting for test results. To keep that in mind, on a typical day, we have about 300, 350 patients here. So we are more than half full with coronavirus. Unfortunately, about 40 of those patients of the 165 are critically ill on ventilators. We have converted the vast majority of our medical wards to coronavirus units, and we've done that by creating negative pressure rooms. That is the safest place for coronavirus patients to be treated, in a negative pressure room. And we've also, at this point, doubled the size of our intensive care unit. And as we speak this morning, we are putting in an additional 40 beds, and we'll be tripling and quadrupling the size of our intensive care unit. The sad reality of this disease is that, and as I said, the vast majority of people who get this get better, but there is going to be a small but significant population of patients who need critical care. And all the hospitals in New Jersey and in New York City are now feeling that. And that is why it is crucial that we create as many intensive care beds as possible and have other beds for patients that can't be monitored safely at home. So all the hospitals in northern New Jersey, Holy Name included, have been increasing their capacity, have been creating more critical care beds. The hospitals have been communicating on a daily basis. We are sharing equipment. We are sharing supplies. We're sharing lessons learned in terms of how we can take care of this population of patients. And that's been very, very valuable.
Do you feel concerned that we'll have enough ultimately? Are you anxious about the state of things?
Yeah, it's hard not to be a little bit anxious. We've been doing a really good job here, thanks to my facilities people and my materials people, and we've been able to stay a couple days ahead of this. We've been getting small but significant supplies from the national stockpile. That's been helping. We've been getting all sorts of donations in terms of masks and gowns from the community. We've been doing some ingenious things. So in terms of masks, we've been able to stay a couple days ahead, but we've been sterilizing our masks using UV light. We're hoping not to have to use those masks, but we will if we have to. We've switched the other day from disposable gowns to gowns that are laundered, which is a major process, but that's working. So we've been able to stay a couple days ahead. We've been able to do the same thing with ventilators. My materials people have been out there begging, borrowing, and stealing ventilators. Stealing is not, I don't mean that. Begging and borrowing, that's a better way of putting it. We're also getting ingenious, as are the other hospitals in northern New Jersey, and we're using devices that are not typically used as ventilators, and we're prepared to use them as ventilators if necessary. So am I concerned? Yes. Am I worried about the next couple days? No. Am I a little bit concerned about the next couple of weeks? I am, as all hospitals need to be. But I know here at Holy Name, we're doing everything possible to make sure that the patients get the highest quality care. I can tell you that right now, I feel really comfortable that we have not had to compromise care at all.
Mm-hmm. And what is the morale of the staff? These are incredibly stressful conditions that they're operating under. Can you tell us, how the staff is dealing with this and what support they might need?
Well, it's really quite remarkable. We've had some tragedy here. We lost a staff member relatively early on from coronavirus, and that was tragic and certainly took the wind out of people. But I have to tell you, it's remarkable. When you walk around the halls of the hospital, despite the fact that people are wearing PPE and you don't always recognize them because they have masks on, et cetera, the general attitude is really very positive. And I think that speaks a little bit towards Holy Name, or a lot towards Holy Name and the kind of people who choose to work here. But it also speaks a lot towards healthcare workers in general, and that healthcare workers go into this because they want to take care of patients. And that's true for nurses and doctors and techs and phlebotomists and really everyone who supports what we do here at Holy Name. And the general attitude is actually very positive. I know that when people go home, they must de-stress, and I'm sure that they're feeling this. But really, when you walk through the hospitals, Dr. Jarrett, how you doing? You feeling okay? How's your family? There's a real general concern. We feel it especially here because it's really a medium-sized place, so a close-knit family. But I'm very impressed, and I have to tell you that I know people are feeling it inside, but on the outside, they're doing their jobs and they're keeping their spirits up, and it's really quite a testament to the people who work here at Holy Name.
Mm-hmm. Mm-hmm.
Practical question from one of our viewers, and she asks, is it true if you get a fever that you can only take Tylenol? She has heard that Advil at this time is not good. What would be your recommendation?
So there is some theoretical evidence that anti-inflammatories like Advil may create problems in patients who have coronavirus. It has to do with the inflammatory response that we see in the patients who are the sickest of the sick. There's really no good scientific evidence for that at this point. What I would say to people is that if they can take Tylenol instead of Advil, it's probably a smart thing to do. But again, there's no real good scientific evidence for this. And if you feel like you need Advil or some other type of anti-inflammatory, you should reach out to your doctor and discuss the benefits of Tylenol or something like Advil.
You mentioned a minute ago, as Lindy was questioning you, about some lessons learned early on here. Is there anything that you could talk about there?
So I think the biggest lesson that we learned is that we have to take these kind of pandemics seriously. There is no doubt that our one bullet for decreasing this pandemic is social distancing. And so I am so proud of the town of Teaneck that they really took the lead on that. And I'm hoping that at the end of the day, we will see some real benefit for that locally. The problem is that this virus does not know borders. So if Teaneck did some social distancing early, and the rest of Bergen County, because they hadn't seen as much disease, did it a little bit later, and if there are parts of the country that are not doing social distancing, this virus doesn't have borders. We need to take this seriously now, and we need to talk to leaders who are out there saying, well, our town isn't really affected yet because we only have a handful of cases. I would make the argument that if you have a handful of cases, it may be too late to do the real social distancing. We need to social distance now everywhere because this virus doesn't know borders. And when you have one infection, it's likely you have two, which goes to 4, which goes to 8. So the importance of social distancing, very important. The importance of doing a better job as a healthcare community in terms of being prepared for this type of pandemic. I think at Holy Name, we were a bit ahead of the curve, and our staff really tells me on a day-to-day basis how lucky that they feel that they work here, because we're doing a good job with PPE for our staff. I think that as a nation, we need to be prepared because, as Dr. Fauci says, this may be the first of many other viruses that come down the path over the next 20 or 30 years. So being prepared as a nation in terms of PPE and ventilators, et cetera. The other thing that we're learning is medication, right? So we don't have medication right now that we know for sure work against coronavirus. There's some very small amount of evidence that maybe some of the medications that we use for malaria might work for coronavirus. That doesn't mean everyone should go out and take one of these medicines. It's really important that you speak to your family doctor and you make a wise decision about whether or not you're a candidate for one of these anti-malaria medicine. And we need to keep in mind that all medicines have risks. There's no medicine that you take, including Tylenol, including over-the-counter vitamins, that don't have risk. And every time you take one of those medicines, you have to weigh the risks versus the benefits. In patients that are more significantly ill, we think we're beginning to see some benefit from certain medicines that are used in rheumatoid arthritis. These are medicine called interleukin-6 blocking agents, and it's still anecdotal, and we have not given these medicines to a large enough population of patients. But I think here at Holy Name, we've probably treated 30 or 40 people with these medicines, and the frontline clinicians are telling me that they believe they're seeing a clinical response. They believe they see the patients who are getting these medicines are having lower fever or having less oxygen requirements. And maybe these medicines are going to be key to treating the most seriously ill patients with coronavirus.
Wow, wow. We had another question from one of our viewers. She asks, if all hospitals go on a divert, where does one go with a true emergency that is not corona related?
So I can tell you what we've done in Bergen County, and I give credit to the other hospitals and the CMOs who have been talking on a daily basis. The reality is that we're all significantly feeling this coronavirus crunch. So amongst the hospitals in northern New Jersey, we've agreed to communicate with each other. And if any one of us needs to go on diversion for a short period of time, we're communicating that amongst each other, and then we're coming off diversion as soon as possible. Being on diversion does not mean the hospital can't take new patients. It doesn't mean that. What that means is that the ambulances do their best to try to not bring critically ill patients via ambulance to that hospital. So it's not about the fact that the hospitals can't continue to take care of patients. It's about making sure that critically ill patients go to the hospital that is best able to care for them. So if we go on diversion for a short period of time, the other hospitals are aware, and vice versa. So I don't think the community needs to be concerned that the hospitals, especially in northern New Jersey, because we're communicating with each other, are not going to be able to take care of patients that are critically ill with coronavirus or with other problems.
Given what we know now about how coronavirus is spreading in the community, is testing still essential? I know every morning there's a big line every other day now at Bergen Community College for people to get tests. But should there still be a push for that, or are we just assuming that people with the symptoms have the disease?
So in an ideal situation, we would test everyone. If we had the ability to test everyone, then maybe we wouldn't have to be as cautious about social distancing. But that relies on a couple different things. It relies on the test being available. It relies on the test having a rapid turnaround time. And most importantly, it relies on the test being really accurate. Unfortunately, we think that the current test that everyone is using may have as high as a 10 or 20% false negative rate, meaning that patients who have coronavirus may actually test negative. So we're hoping that there may be another generation of tests that not only are more accessible, that not only have a rapid turnaround time, but are much more accurate. In that, if we could have that, then everyone should be tested. In the reality of what we're facing, we really need to keep the test available for the patients who are the most sick. Unfortunately, as I mentioned earlier, everyone should assume that they have this virus, and they should treat themselves and their community members as if they do. That's how we're going to stamp this thing out. But if you have significant symptoms, there is now testing available, and you should be tested if you have significant symptoms, particularly if you're in a high-risk group. We expect that we're going to go live with in-house testing here at Holy Name either tomorrow or Monday. When we do that, we'll have the ability to test probably about 150 people a day. We think that the test is going to be more accurate, and we think that we will use that initially on the sickest of the sick, because that helps us triage patients and make sure they get the appropriate care in the hospital. Hopefully, over the next several weeks, if not over the next several months, those kind of testing will be more available, and we'll be able to test everyone.
And Doctor, as a point of reference here, if you go online with that testing, how should people, should they just show up at the hospital, or should they call the hospital first, go to their doctor? What do you think?
We're going to keep our current process in place, because even 150 tests a day is not enough to make this widespread. So our current process is you should reach out to your doctor. Your doctor should make the assessment as to whether or not you should have a test. The doctor will then call Holy Name and arrange testing if appropriate. Gotcha.
Doctor, I wonder if I could just switch a little bit here and talk about how do we explain this to young children? I know little children, they want to hug their moms and dads. They want to see grandma and grandpa. They want to play with their friends outside. Do you have any recommendations on how we should talk to kids about this?
I do, and I think that's a really important question. So I'm a big believer that we have to be honest with our children as early as possible. Now, there's ways to be honest and be gentle, and there's an awful lot of good news as it relates to coronavirus. And I'll say it again, the vast majority of people are going to get better with this disease. And so children need to be told that. They need to be told that their parents are more than likely going to be fine even if they get infected, and that they're going to be fine even if they get infected. The good news is that we are not seeing significant morbidity with children. My advice is that you tell children that they're really part of the solution, that they really need to be healthcare heroes, and that by socially distancing themselves from their friends, potentially from their parents and from their grandparents, they're part of the solution. And they should be rewarded for being part of the solution, what they're doing is really as important as what doctors and nurses are doing, because by socially distancing themselves, they're preventing an infection. And when they prevent an infection, they prevent that cascade of infection that I talked about earlier. So I think we need to be honest with our children gently. We need to tell them how important social distancing is. We need to let them feel like they're part of the solution by socially distancing themselves. I know that's not going to be easy for many of them, but I think if we rely on that message, that they are really healthcare heroes when they socially distance themselves, and they're not just protecting themselves, and they're not just protecting their family, but they're being good citizens for their entire community and the entire country and the entire world, that's the message we need to send to our children.
I know we said we'd keep this to 30 minutes, but I wonder if you have a few more minutes, because I know Lindy has a few additional questions. Lindy?
Absolutely.
I'm very interested in what you and other health workers do to relieve stress. You know, how you set it aside and fall asleep at night.
Right. So we've been talking about that here at Holy Name for the entire time we've been in this. And we have, for our nurses and for our doctors and for our other staff, we have what we call an employee assistance program. So staff who are really feeling stress can reach out to therapists and psychiatrists and social workers that we make available. We've also been talking about the fact that this is a marathon and no one can work 24 hours a day, 7 days a week. So although we're all on a 7-day work schedule here now, although the frontline people are not, but the administrative people are all on a 7-day work schedule. We've loosened up in terms of what that means. So I know for myself, I relieve stress by running. And so I've actually been coming in a little bit later many mornings and making sure I get my morning run in. And we're telling people that that's the kind of thing that they need to do, because we're not going to be any good for the community we serve if we either get sick or if the stress of this takes us down. So we all need to make sure that we take our time, whatever that time means. And hopefully that's time with your family, that may be time getting some exercise if possible, maybe listening to music. And for the employees and the staff who really feel like they need to talk to someone, we have that resource available.
Doctor, I just wanted to, there's a hospital that sort of talks to how we can perhaps protect ourselves from this virus. And I'd just like you to talk a little bit about how we could build up our immune systems. This one report says perhaps people should drink warm liquids, maybe even drink a cup of hot water several times a day, that sort of thing. Do you have any thoughts on that?
Well, I think we need to be really careful when we hear those types of recommendations. And I'm a big believer that modern medicine doesn't know everything. And there are therapies and treatments out there that modern medicine just hasn't figured out yet. And so when someone says they have to, if you drink warm water, that they're going to get better or improve their immune system, I would say to them, probably not. But if it's warm water and you want to try, sure. If you tell me that you're going to drink boiling water because you heard that that's going to impact your immune system, then I would say, you're trying something that is very risky, and there is certainly no proven benefit to it, and so you should not do that. People who say to me that they want to try taking certain vitamins, I say in the right amounts and you're not putting yourself at risk, you absolutely should do that. You have to weigh the risks and benefits of everything you do in life, not just healthcare, but everything you do in life. And if there is a known potential risk and there's no proven benefit, you shouldn't do it. If there's no known risk and the benefit is unknown and you want to try it, absolutely. Drinking warm water, if you want to give that a try, sure. I'm a little skeptical, unfortunately, but I certainly don't know everything. And if you want to drink a little warm water every day, go for it. But if you want to, I've heard some people said that gargling with certain caustic things may help with
like
the virus.
Like vinegar.
Yeah. Or I've even heard people drinking excessive alcohol. Certainly anything that has any risk, you don't want to do unless there's proven efficacy. And for all those things, there is no proven efficacy. And I strongly recommend to your readers and your listeners and all those people that are listening, use common sense. If someone tells you to do something that they say there's a benefit, the first question you ask yourself is doing that putting myself at risk? And if the answer is no, it's not putting myself at risk, and you want to give it a try, sure. But if it's putting yourself at even the smallest risk and there's no proven benefit, you shouldn't do it. And I feel that way about over-the-counter medicines. People say to me, well, I'm just going to take Tylenol. Is that okay? And I say, Tylenol is a powerful medicine. It's over-the-counter, but it's a powerful medicine. And there are certain risks involved in taking something like Tylenol. There are certain risks involved in taking something like aspirin. And so you always have to weigh the risks of something that you're doing in healthcare and in life with the potential benefits of it.
Mm-hmm. Lindy, I know you had a few other questions.
So I wanted to ask also about how people should prepare for if they do come to the hospital, what types of communications they should have with their family, since we understand that there's no visitation. And as it becomes serious, what types of issues they should address.
Well, so one of the saddest parts of this disease is that you come into the hospital and to protect you and to protect the healthcare workers and to protect the community, all the hospitals are appropriately isolating people. And that's really difficult. It's hard enough to be sick. It's really hard to be sick when you're in isolation. And that also puts an extra burden on the healthcare workers who are now just not functioning as healthcare workers and nurses and doctors and technicians, but they're functioning as pseudo family members and providing that type of support for the patients. What we're doing here at Holy Name is, as much as possible, we're trying to allow families to connect via telephone or via telemedicine. That is the best way to do this, so the families can stay connected to their loved ones. We're also trying, and we're communicating with families on a daily basis on the healthcare level in terms of giving daily updates in terms of what's happening to family members. The real tragedy of this disease, besides the fact that it's going to have a significant amount of morbidity and mortality, is the fact that the patients who do get very sick really get very isolated and then are not able to visit with their families. I know some of the other healthcare facilities are thinking about loosening up on that, and I understand why they might be thinking about doing that. At this point, Holy Name has not decided to do that because we really feel that we need to protect the entire community and protect family members. And we're concerned that putting family members in PPE is not a good idea. Putting PPE on, taking PPE off, there's a technique to that. And if you do it wrong, you're putting yourself at risk and you're putting your community at risk. So at this point, we are still requiring all patients who have coronavirus or possible coronavirus to stay in isolation, and we're doing the best we can to allow patients to communicate with their family and their loved ones. But it is a real challenge for taking care of this disease.
Something I'd like to get back to, a more practical issue, Doctor. If you do venture outside to, say, walk around the block or take a jog as you did this morning, when you come back into the house, should you wipe off your shoes with a disinfectant? And what about your clothes?
Well, I don't think you need to wipe off your shoes. You could do that if you wanted to be incredibly cautious. I don't do that. What I do when I come home from work or when I come home from a run is my clothes that I'm wearing go into a bag that I'm keeping as my coronavirus clothes bag, and then that gets laundered separately. And then we're being very cautious around the house about washing hands multiple times when we do the laundry, after we do the laundry. I think that's key. We know this virus can live on inanimate objects for periods of time, but if you're washing your hands frequently and you're washing your hands correctly, you're really doing everything you can do. And again, we're not going to prevent every single infection. There's just no way. You're nervous working in a hospital because you're around more people with coronavirus. I am, but I'm around people with coronavirus that are sort of labeled as having coronavirus. So if I go to a patient area, I wear appropriate PPE. And the good news is we're not seeing a lot of healthcare workers who are becoming infected who are wearing appropriate PPE. If you go to the supermarket, if I'm out for my run, I don't really know who I'm potentially being exposed to. The answer for that is not to completely distance yourself, because you have to go to the supermarket. And I hope we don't get to the point where we tell people they can't go outside as long as they're socially distancing. But I think the smart thing to do is to socially distance, stay 6 feet away, wash your hands, shower when you get home from work if you're a person that can't work from home, shower when you come home from your outside exercise. Even when you're outside, you should not be playing contact sports or basketball or softball, sports that rely on people being close to each other. If you have to be within 6 feet of each other, you shouldn't do it. That's the take-home message. And if you're staying 6 feet away from people, you're really about as safe as you can be.
Mm-hmm.
Well, on that note, Doctor, I'd like to end. I'd really like to thank you for your time. I know you're extremely busy at the hospital, working every day, and we deeply appreciate you coming on. And I hope we can do this again at some point. I'd also like to thank my colleague, Lindy Washburn, who has been working around the clock as well. And in the studio, I'd like to thank our director, Mike Pedagano, and our social media coordinator, Elise Toribeo. And I'd also like to thank all of the viewers and listeners who wrote questions. Please feel free to contact us at northjersey.com if you have anything else, and follow our coverage. Again, Doctor, thank you very much.
Thank you. It's a real privilege. Everyone stay well out there.
Okay.
You too.
Bye-bye.
Bye.